Hi everybody, my name is Lena, and today we'll be going over what does it take to become a neurosurgeon. And so this is kind of going to be your educational requirements that you need in order to become a neurosurgeon. Okay, so first of all, let's talk about what is a neurosurgeon. So a neurosurgeon is someone who specializes in surgeries that are concerning the nervous system. So this primarily includes your brain and the spinal cord. And so this is the schooling that it takes to be a neurosurgeon. I will upload more videos going more in depth about certain things that you need to do while in med school or while in undergrad or in any part of the educational program. I will include more videos on what exactly you need to do, but this is just going to be a brief overview of what exactly you will do in each of these schooling requirements. Okay, so the first one is your basic. You need a high school diploma, so it's important that you have to graduate from high school with a solid GPA to help you get into a solid undergrad school. The second step is going to be undergrad. So when looking for colleges, you need to look for ones that are primarily into research and their pre-med programs because you want to go to a school that places an emphasis on these programs. And so you want to choose a major in one of the sciences, including chemistry or biology, and then take some prerequisite medical courses. And so these can include microbiology, biochemistry, human anatomy, organic chemistry, advanced mathematics that includes statistics, this is very important, and then psychology. Of course, it will vary from college to college to make sure you're looking into what the college will offer. Okay, then you will take the MCAT. So the MCAT is the medical college admissions test, and so it's important to get a good score on this because it will allow you to get into a good medical school. So like the SAT or the ACT, how it used to be a requirement for undergrad schools, the MCAT is a requirement for medical schools. And so this test is designed to test your scientific knowledge and your ability to problem solve. And so it's usually taken during your junior year of college, and you will submit this in your application to medical school. Okay, so this is medical school. So medical school, there are mainly two parts of it. There's schooling and then there's rotations. So during schooling, you're going to be focused on course and lab work, and this will help prepare you for patient interaction. And so you'll work in the practice of medicine, biology, medical ethics, and etc. And so during this first part of medical school, during your second year of medical school, you must pass the U.S. licensing examination test, and that will help you move on through medical school. Next, you're going to do rotations. This is your second part, so your second half of it, and then you will experience various medical specialties. And so during this time, you'll experience a variety of medical settings with hands-on experiences under qualified neurosurgeons and neurologists. And so during this part of med school, you will take the United States Medical Licensing Exam, Step 2, in order to test your clinical skills and your knowledge. Then you'll conduct an internship, and so this will be a 1-year hospital internship. You'll work in a hospital setting with patients, and basically what you'll do is you'll essentially apply what you learned in medical school under a qualified doctor. Next, you have your residency program, and so for a neurosurgeon, this is about 6 to 8 years of residency, which may seem like a long time, but you have to realize that you're actually performing the surgery. This is in neurosurgery, you're going to be operating on the brain, so it's important for you to gain the full knowledge as much as you can. And so during this part, you will work with licensed neurosurgeons. You will learn the skills and techniques that are required for surgeries. And when you have learned enough, or when they feel as if you have learned enough, you will be able to get the opportunity to scrub in and assist the neurosurgeon in the operating room. Alongside with the technical skills, you will also attend lectures and discuss scenarios involving actual case studies. So you will be learning and putting that to work at the same time. Then you have your special training and fellowship. So this is focusing on specializing in a specific field in neurosurgery. So some could be oncology or pediatric spine surgery. And this may vary by program. So certain programs may take 2 to 3 years, while some take 4 years. Finally, you have your licensing/board certification. So this is when you're going to take your licensing and certification exams to certify for you to be able to become a neurosurgeon, and these can include oral and written components. And so the exact description depends on the state that you are planning to practice in, and so it's important to follow those state and the overall board requirements. And so after this, you will continue to study, and you will renew your license on a timely basis when needed. That way you can continue to keep up your practice. And so in summary, the 4 steps is undergrad, med school, intern, residency, fellow, and then your license and practicing. And so thank you so much for joining this presentation. If you have any questions, you can email at that email, and I will be posting more videos going more in depth about the educational process. Thank you.